make sure I remind each of you to that Sunday is Mother's Day. And we want to make sure that those individuals who really carry the weight of the world on their shoulders, that you remember to honor them, to say thank you for motherhood is such a precious thing. And for all the guys that would have forgotten if I didn't tell you, you can thank me later. This webinar will probably go the full hour and a half. We have a lot of information to share with you today. You can use the chat button to ask questions. And yes, we are live. I see a couple of people who are already using the chat. If you are having difficulties with the webinar, you can log off, log back on using Google Chrome, and hopefully that will work for you. And if you just happen to hear about the webinar this week, but would like to sign up to make sure that you're not missing any, there is a link on the screen. You can just type that into your browser and you'll be able to register and receive these invitations directly. You can also send that to your friends and others who are interested in staying abreast of what's going on and hearing about the latest as it relates to COVID-19 and the reopening of Palm Beach County. Another thing is, as I mentioned, we're going to be recording this webinar. Usually does not take the full 2 to 3 days for it to post. You can go to pbcgov.com/community services to see the updates. You'll see a COVID-19 banner, and you'll see a link there that says weekly webinars. You'll be able to access all of the webinars that we've done thus far from that site. Today, we're happy to have Dr. Alonso back. It was great having Shamla here last week. She's very knowledgeable and is an intricate part of our team. But we love Dr. Alonso, so I'm really happy to have her back with us today. She'll be giving us some local updates on COVID-19 and where we are, looking at testing and our infection rates. We'll also take a look at the latest executive order by the governor and just talk a little bit about that and what the implications are for Palm Beach County. As you know, the executive order left the southern region, Region 7, Palm Beach, Broward, and Dade County and Monroe County. There was a provision for us to consult with him, our local elected officials, when we are ready to move forward. And so the executive order would exclude Region 7 or the southern region of Florida, but we'll give you an update on where we are and what will likely be happening in the next coming days. We also want to hear from a couple of key community partners today. We're going to, Jessica Sisir, the CEO for Nonprofits First, will have an opportunity to give an update on what they're doing and talk about some important work that we can potentially be engaging in as nonprofits. And then we're going to also hear from our community partners, if whomever would like to share. I know CareerSource is one that we hear from first, but we also like to hear from our VP of Hunger Relief and other community partners like Southeast Florida and DCF and others who are critical to the work that we do. All right, so without further ado, I'm going to turn this over to Dr. Alonso. She's going to go through some slides and we'll go from there.
Okay, well, here I am with my data. I'm trying to keep all these people to behave and follow the data and follow the science, and it's getting harder and harder, but that's okay. We'll keep trying. I just want to say, James, that the love is mutual. I have been doing this for 30 years. I've been in this EOC many, many, many times. nothing has been like this pandemic. But I have to say that thanks to the crowd that we have here, the team that we have here, we're actually smiling still, and we haven't killed anybody. And so you guys have been wonderful. I absolutely love you, and I wouldn't want to be working with anybody else. But I do want to get out of here. So let's start with our cases. We're up to 38,000 cases in the state of Florida, and we have 1,539 deaths so far. The deaths are still coming. If you see right here on the right side, we have these are the daily cases, and you see these spikes here, and that is why we have not been able to fulfill the requirement of having 14 days in a row with the cases going down. The reason for these spikes is not because we're having increased cases, it's because the lab's results are coming back in batches. So early on when this began, even though you can draw a trend line here, you can see that the trend is going down. But even before that, we turned to the term test positivity rate. And I will show you how that works and how that is different from the new cases every day. We also are looking at the death rates. And again, we have spikes because the medical examiner has to wait for lab results to come back positive on some of these cases. And therefore, some of these, again, come back in batches. It doesn't mean that overnight we had 10 or 15 deaths. That's not what that means. It's the number of deaths by date, but these big spikes are not something horrible happened in the hospital and everybody died. So with those types of little fixes that we've done, we've created some health metrics that we want to measure. The other thing that we have, and I hope you guys are going on Florida Health, flhealth.gov to take a look at this information because it's very useful, especially the one that goes by county. So if you click on Florida cases, and you can go to cases by county, and you can click on the county that you want to see. So when you click on Palm Beach County, you see 3,480 cases that we have now. And when it says here residents, that means that 3,413 are actual residents of Florida. There are 2 residents that are not in Florida that were actually, one was in Washington State and the other one was somewhere off on the West Coast. And then we have 65 that are not residents of Florida, but that they're here. So we're counting those people in the total cases that we have in Palm Beach County. Now they get reported for the county in which they live, but we count these for people that are in Palm Beach County. The other thing that we get in here is the deaths. We had 215 deaths in Palm Beach County, and the number of hospitalizations. This does not mean that these people are in the hospital now. That number continues to go up because it's additive. You can have a little bit on the demographics here, gender and race. So far, out of the people that we've tested, we have 16% Black, 46% white, 10% other, and we have a 28%. This has gone down quite a bit for unknown. We found a whole bunch of data that was being reported by the healthcare district, and they were capturing the race and ethnicity, but they weren't reporting it back to us. So we had a big hole, and once we realized that those were the numbers, they gave us 13,000 names, and we have been entering that information. So we're down to just a 28% unknown, and it continues to go down. It's gone down 2 days in a row. So that is good. Okay, this one. That's the one I want. Okay, so here's what we decided to look at instead of looking at the number of cases. So what we do is we take the positive cases that we have divided by the total people that we've tested, and that gives us a positivity rate for the test. We are at 9.5. That's the lowest we've ever been. that means we're testing a lot of people and more people are coming back negative. Now we're still getting positives, but the more you test, the more you will see the negatives. And that gives you a better picture of what percentage of the people that you've tested are positive. So we're at 9.5%. That has come down. We originally, when we started, we were at 20%. Why? Because we were testing only people that were in the hospital, like ready to go to the ER or in the ER. And then slowly we started opening up our drive-through, and we started testing a lot of people. So now we're almost very close to Broward, and Miami at one point was 5 times more people than we are now, and now we're almost at close to half. So we've caught up quite a bit. At this point, we have tested 2.2% of our population, which is really good. So the other piece that we can look at also is right here. It's the person tested by week, and we can see that we've been increasing. Then we have a little bit of a low, and then this red is the percentage of the positive. So you can see that it's a very small percentage, right, of the rest of it, but that's a good thing. Some days it looks like it's a little bit higher, but we've been able to maintain a decreasing positivity rate. So that's one of our things that we're looking for in terms of measurement. You can also click, when you're live on this model, you can click on the other counties. You can look all around. 60% of our tests for Florida are in Region 7. That's Palm Beach, Broward, Miami, and Monroe. Monroe has a blockade, so they're not letting anybody down to the Keys, so they're staying clean. The only way you can go down there is if you fly. So if anybody has a plane that they could take me down there, I'd love to spend the weekend in the Keys. If anybody could fly me down, I'm requesting aviation resources. Okay, here's a little bit more of the data that we gather. One of the things I want you to see from here is this nice bell curve that we have for age distribution. This is pretty much our age distribution that matches the population. However, the number of deaths doesn't look anything like this, and I will show you that in another graph. Okay, this is the new cases by day. Again, we will never have a 14 days in a row because of these spikes. The other feature that this dashboard has is to be able to look at cases by zip codes. So you can zero in on Palm Beach County. You can click on all these different areas to see what there are. And what I did here is I'm a little nerdy, so I went in and clicked on each one and put in the number that we have for the day. It takes a little bit of time, but that way you can see your specific zip codes. Our highest zip code is in 33430, which is Belle Glade right here. They have 184 cases. Pahokee includes Pahokee and Canal Point, that's 40. Now notice that this part of South Bay is included in that zip code. The other part of South Bay is over here. They only have 33 cases. Now, part of this they have got going on in there 2 cases that have added quite a bit to these numbers. That's the Geo prison that's out there. That's a privately run, whatever you call those things. They're being run for profit. Okay, no commentaries, Alonso. Just stick to the facts. Anyway, it is a fact. And they have quite a bit of cases, especially what I'm very concerned about in the staff. That staff is out in the community, is in Belle Glade, is in South Bay, and some of them are in Broward. So I'm very concerned. I've talked to the municipalities and asked them, please continue the message of safe distance, stronger together, 6 feet apart, wash your hands, keep your masks on in public or your face covers. This is very important for this whole area, as it is for everybody, but I want to continue, and we will continue testing. We have the drive-through, the walk-through, and other people are going and doing testing in this area also. The other area that I'm very concerned about is this area here, which is Atlantis and Green Acres. It's this little section right here, 33463. First, this had just this little block. Then it went to the north, which included 33415. And then it extended, so it was here first, it extended here, then it extended east a little bit, and now it's all the way to Lake Worth, which is the 33460. This is alarming because we know these are a lot of uninsured, underserved population. We don't have a testing site in this area. We have it here with the, we've done outreach at the Guatemalan Center. We have the Found Care. We have the Lantana Lake Worth Health Center for testing. So we have quite a bit of testing in this area, but some of these people don't have transportation and so forth. So this is an area of concern. We're going to see if we can get some more help in there. The other area of concern here is Boynton Beach. This is Genesis is working there in one of the churches. They're doing a lot of testing, and we're hoping to get them some help also to do some of this. This area here is right over Kings Point and High Point. These are condos, and this area is out west of Jog Road in Boca, which is a mix of seniors and other folks. But the interesting thing is that a lot of the testing that's been done up in West Palm so far with fire rescue and going into the homes of the folks that are homebound, we've had no positive results. And it kind of makes sense, because if you're homebound, you're not going out. That's the safe, that's the safest thing that we could be doing. So these people are protecting themselves by not going out, not getting exposed, and staying home. So that's actually a good thing. And this is the rest of our, so we're also looking at the emergency room visits with influenza-like illnesses. So we can see that, you know, prior to March 23rd, this was actually when we started, it was March 12th, actually. We were pretty much at 0 visits at that point. It really went up quite drastically. I would say this was the peak towards the end of March, beginning of April, and then it has slowly gone down. So this is a very good thing. We're almost at the just normal level again, which would be it's a very good indicator. This is exactly the same thing. These are specific emergency visit with COVID-like illnesses. So very similar to this, right? The fever, the cough, the shortness of breath. And we also have the ones that are admissions. That's another one that we have that looks very much like this. Again, the important thing here is all these peaks are in a similar place. That to me is reassuring. It's not just one indicator alone. It's all of them, looking at them together. So this is what we do when we do the curve in terms of it's going down. And this is the percent positive for laboratory testing. This is measured a little bit different than the positivity. This is a graph that we have that has each day what percent of the labs we tested and how much was positive and how much was negative. The target for that is to be at 10%. We're way below that at, and it's been going down for many days steadily. So that is also a good indicator. This is that positivity for the labs. That's what this looks like. So we're down to 5.7. That's way almost half at what the target of 10 is. So that's very, very good. And we're beating, we're definitely ahead of Broward and Miami. This is a little bit more of the same thing in terms of the cough, fever, that they show up at the emergency department. And this one is just the cough alone, how many were admitted. So as you can see right here, we're actually at this 0.5% in February before all this started. This is the normal admissions for cough. You had pneumonia, you have other things, right, that have cough. And then you see this peak again, the end of March, early April. and then it's slowly going back down. So we're pretty sure that the hospitals are at a good level. Our admissions are good, but the hospitals all still have to be very careful and make sure, for example, when they start doing elective surgeries, they have to make sure that they have enough capacity in case we get a spike, that they would be able to convert beds back into ICU, that they have enough ventilators, that they have enough staff on hand, that they have enough PPE. All those things have to be available and able to use it so that we can rest assured that things are going to go right. So we're looking at all those things before we open things up. I hope that we will continue to look at those things before we open everything up. Here's some more. Here's our trend lines for our positivity. What we did was we took the standard deviation with all these peaks and valleys, and what you can see again around the end of March, beginning of February, you can see the peak right here that's consistent in each one of these graphs. This one is the one that's alarming. It's the nursing home positive residents that actually has been going up. And part of that, hey, you're not speaking, I am. Get out of there.
Yeah, you can sit on this.
I'm not worried about it. I'm just teasing you. So seeing if everybody's awake. So this has been going up, and we're trying to get help. We have teams that have come in with the National Guards that have each team has a infection control practitioner who can assist. They can stay in the place and actually help the folks with any assistance that they need. They're testing both the patients in the long-term facilities as well as the employees. And of course, we have found positive both patients and staff. It's very difficult in a situation like that to try to control it because they just don't have like separate rooms. These people are sharing rooms and so forth. And of course, this one down on the bottom, the number of deaths associated with COVID, we see that we have a very nice curve actually going down. And again, looking very similar to when prior to beginning, almost the number of deaths are almost back to normal again. This is specifically what I want you to look at here is the difference. This is the same as the age distribution. You see a nice curve. That's what our general population is. With the cases, so you see that cases as young as 15, 24 years old, all the way to 104 was the oldest person that we had that was a case. But when you look at the hospitalization, it starts getting heavier as you go down, right? And when you see the deaths, 90% are all right here. Okay, so 55 to 64, 10%. Our highest 2% are above the age of 75 and above 85. So that's 60% of the cases right here between the ages of 75 and 85. So the death rate is definitely among the elderly, whereas the distribution of cases is pretty evenly distributed along with our population. What that says is that the younger folks that have cases are not being hurt like the elderly. That also is a huge concern because these are the cases that have been tested. But imagine how many people do we have that are asymptomatic and have not been tested. They probably are in this age group. So we have to keep that in mind as we go forward, because obviously that is something that is going to affect if these people start hanging out and stop isolating. We will have another resurgence of this virus very, very quickly. And here we've broken this down. Again, we've gotten this down, the unknown race and the unknown ethnicity, we've got it down to 28%, 27%, and it's gone down the last 3 days as we continue to enter labs from the ones that are not entered, the ones that are done at the private labs that don't come back to us with the race and ethnicity. We're having to enter those manually. So I've got a team of people doing just that. And again, you see the death here, the biggest group is among non-Hispanic whites. That's 64% of those elderly deaths are non-Hispanic whites. The Hispanics white only make 5%. Black is 15%, which are all non-Hispanic. And under Hispanic, you have very, very small numbers that are almost, I mean, there's still people that have died, but the percentage is almost negligible compared to the total. So Palm Beach, basically our hospitalization is below the state hospitalization, but the deaths are at 6% of all the cases, again, because of this very large elderly population that we have in Palm Beach County. Makes us, we've been going between 6% to 5% of our cases are in the elderly, and that makes that percent of death much higher. I think that's the last slide.
Yeah, let me, oh, yeah.
Oh, okay, yeah. So these are the testing sites that we have. I think there's like about 26, 24 different addresses here. We have commercial labs, we have the governmental healthcare district labs, as well as the VA, and then we have the nonprofits like Genesis and Found Care, as well as some other groups that have volunteered to help in different parts of the cities. So let's see what you got for questions.
Let's see. I'm wondering what the racial breakdown would look like if percentage of population.
We have done that. That is available. The percent of Black population in Palm Beach County is 18%. The percent of Hispanics is 23%. So there's very little variation from, I mean, the percent of cases are in line with the percent of the population. We're not seeing that huge disparity. However, I still have 20%, 28% that is unknown. So before I will say that there isn't, we need to test more people, and we need to continue to clean up the data so that we can see what that looks like. I've got to ask a question at the Board of County Commissioners. I don't know if any of you saw that, but that was maddening. It was a circus. I'm so glad I'm not in politics. One of the questions they asked me was, well, you know, we're at a very good percentage and this and that. I said, well, actually, I can't say that because we don't have proof that we are. We don't have that data in terms of the percentages of. We only know what we know of what we tested. With only 2% of the population, I can't tell you anything about a lot of these statistics. So he wanted me to go down the rabbit hole, and I wouldn't go, and he didn't like it. But you know, I'm trying to tell the truth, and it gets a little hard there when they want to paint a different picture. But that is what it is.
You want to take a stab at the next question? Will additional schools, hurricane shelters, hurricane season?
Yeah, one of the things that I'm saying is that one of the things that we're doing next is preparing of how to handle a hurricane in a pandemic. Never would a positive person with a contagious disease be put in a shelter. We're going to have no choice than to put people in shelters if we have a hurricane that we know may be contagious. So we're going to need more space per square footage to allow for more distancing. I even see in the special needs shelter, for example, we may have to have a section that's just for people that we suspect are positive and another section for the others. We're just not going to be able to separate them because when they come in, we're just not going to know. We're not going to know if they're positive or not. And, you know, they're on oxygen, they're on all kinds of things. So it really makes for a very difficult handling of this. And even more so in the general population shelters. In the past, you have never let somebody in with a temperature or something like that to come in. How are you not going to do it now? I mean, if it happens, you get a hurricane now in June or July, we will definitely have people with cough. Everybody's going to stay away from. All we're going to have to demand that people put on masks, that they try to maintain that 6 foot or more distance. And my problem is going to be getting people willing to work in the shelters. It's been very hard to get staff. to work in those shelters. I can't imagine who would want to work in those shelters now. But somehow we'll get through it. We always do. So I'm confident that we'll make it work.
Any other questions for Dr. Alonso before she has to leave?
Okay, well, hang in there. We're in this all together, and our motto here is stronger together, 6 feet apart. So we're going to keep saying that to everybody, and wear your masks.
Thank you, Dr. Alonso. All right. So we're going to just talk a little bit more about where we are. As mentioned before, it looks like this is a little bit off. I don't know what I can do to maybe fix it. I'll try to work on that momentarily. But you guys know that the governor did give his executive order maybe a week or so ago, and he kind of laid out the overall plan for Florida and how to move forward. He wanted to make sure that we were kind of in the right place. And so the strategy is to make sure that we can continue to protect those who are 60 and older with underlying conditions, to continue to ramp up testing. And he went through each of these very specifically, to continue to promote things like social distancing and make sure that our hospitals and our healthcare workers were protected, to make sure that we were looking at our ALFs and our nursing homes and that they had all the PPE, all of the things that they needed in order to sustain themselves. And also looking to prevent people from coming in from other parts of the state. So all of those things were included in his strategy. And we moved to phase one. We're still in phase one, where schools kind of remain closed, but and they're doing the distant learning, so they're not closed, but they've moved to online. That's going to remain in phase one, as outlined in his executive order. They're still not allowing visitors to come into the senior living facilities and the ALFs. Elective surgeries have now began, but you heard Dr. Alonso talk about some of the provisions in the executive order that they are able to adapt if a surge occurs. So they have to have those surge plans and make sure that those ICU beds can become available, have ventilators. They have to have enough PPE. So there are some provisions that are laid out in his executive orders specific to hospitals, ALFs, nursing homes, and other facilities that provide any type of health care services. Restaurants are able to open, but they have to practice social distancing, and they can only operate at 25% capacity. And so those provisions were given. Again, Palm Beach, Broward, Dade, and Monroe County were excluded from these provisions. You'll hear about, if you were able to watch the county commissioner meeting on Tuesday, there was some really intense debate about whether or not we as Palm Beach County should have been included in that phase one order. And so there is a provision that does allow beaches to be open. And so the board will be hosting a special meeting on tomorrow, and they'll discuss what it might look like if our beaches were open. So our board and our local elected officials now have the power to open the beaches, but they want to make sure that they have a plan and that we are ready. And so part of that will be discussed on tomorrow. They'll also likely touch on whether or not we should be included in phase one. As you know, there was a regional strategy. Even though our local elected officials maintain the right to make decisions on behalf of Palm Beach County, it was wise for them to consider a regional strategy, because if our beach is open, then you would likely have individuals from Broward and Dade County coming here, and it caused some issues in the past with restaurants when we weren't kind of synchronized. And so they're just thinking through some of those issues and how we might strategically begin to reopen and what the implications will be. So they talked a little bit about that on Tuesday, and they'll reconvene to talk about the beaches and that plan. And also, again, they're looking to explore whether or not Palm Beach can be included in phase one, and if so, to give the governor information about how long we would need, whatever the case may be, and so that he can respond and we can coordinate. So, interesting meeting should take place tomorrow. If you're interested, you can go on pbcgov.com and find out information about that. I'll try to send out some additional information as well. But in terms of phase one, retail, they can now operate at 25% indoor capacity, and there's still a provision where bars, gyms, personal services, things of that nature, hairdressers, where they will remain closed. One of the things that our incident commander and county administrator reviewed with the board was just a consideration of how some of the dollars that have come down from the federal government for this COVID-19 crisis could be allocated. And so this was just an introduction, a starting point in terms of what it might look like. And obviously is very broad, and there'll be more discussion about this in the coming days. But you'll see where out of the 261 million, 35 million go towards general governmental expenses. And then you see there with the emergency food, another 35 for housing and rental assistance, or 40 for unmet needs, 10 for small businesses, 25 or less. It's proposing that 50 million be allocated towards that. And for businesses with 25 employees or more, another 10 million to be allocated for that. For the testing, and again, this funding would not just be or exclusively be for the county government, but working with municipalities and others as well. You'll see where for the testing, there's 35 million that was proposed for that. And for some of the non-congregate shelter, another 10 million. For a reemployment training, another 15 million. And for broadband enhancement, another 10 million. And then 11 million or so for reserves. And so this, again, is not set in stone. This is just the framework to get the board to think about how we might begin to utilize these dollars that have come down from the federal government. There are some provisions as to when these dollars would need to be spent. So there's a time frame and some parameters that will need to be adhered to in utilizing these dollars. And so you'll be hearing more about the CARES funding in the coming weeks. We're working internally to kind of flesh this out a little bit more, and they'll be taking this information to the board, and the board will then decide on what those allocations be, and we'll move forward from there. So again, there will be implications for a lot of our community partners. We'll keep you abreast of progress in this particular area. Another thing that our incident commander discussed was an overview of what our phased reopening might look like. She took a moment to highlight some of the top sectors here in Palm Beach County: healthcare and social assistance, retail trade, accommodations and food, and administrative waste services. So those are that they make up a large portion of our employment sectors. And these were some of the businesses that got hit the most. And so what the incident commander is doing is she proposed to the board that we develop working groups that were around tourism and hotel and accommodations, around retail, education, business and professional services, healthcare, agriculture, and transportation. And these working groups would then convene and develop strategies, reopening strategies, so that we can be strategic in our approach to moving back to through that phase. And so we will keep you posted on this as it develops through this forum and through other forums as well. And so as we begin to think about what we might need to consider to reopen, this is, again, a graphic that was pulled from the Department of Health's website that outlines, I won't go through it in its entirety, but just some steps that you might begin to think about for your organization, some things that would help as you are ready to reopen. And we're going to have Jessica to kind of talk a little bit more about this momentarily. But as I mentioned on the previous call, there is the Osha guidelines that have been published. Those guidelines are being utilized and were utilized for the governor's work groups as he started planning for his phase reopening. If you haven't had an opportunity to go to the website, you can go to pbcgov.org or .com and go to the COVID-19 page. You can look at, there's a section there that says reopening for the state. You click on it and a lot of this information, these resources will come up. And so I would just encourage you to really take a look at this guidance that was issued by Osha. Take a look at some of the guidance that has been issued by the CDC. And those things should be useful as we begin to think about the implications of reopening here in Palm Beach County for your respective business. And so with that, I'm going to turn it over to Jessica, and she'll talk a little bit about what they've been doing, what Nonprofits First has been doing, but also introduce this concept of a work group for nonprofits as well. So Jessica.
All right, thanks, James.
Hold on.
Well, the slide will be up there in a second just to help me go through it, but I guess I have my own as well. But
yeah, I have it up. Let me see it.
Flip to the first one that has the
okay, let me see if I can
on it.
Give me 1 second here.
Sure. I think you were just about there.
Yeah, it just keeps going all the way to the last one. Is this the first one or the next one?
I believe that's it.
Okay. All right.
Very good. So James, good afternoon, everyone. So I'm Jessica Sisir. I'm the CEO of Nonprofits First. Some of you know us, some of our community partners and nonprofit organizations know us from accreditation, and some just know us because they're members and seek our services. So James asked me to put together, what we've been up to since we've all been social distancing and isolated and working remotely and those kinds of things. And I'll let you know that, Nonprofits First is open for people to work in our office, but not open to the public. And we do have 2 staff members there that have chosen to work at the office rather than work remotely. And that, is completely up to them as long as we felt the building was safe. And a lot of us moved back and forth and then, or either work remotely. So that said, I am working remotely today. And so if my dog barks, what can I tell you? It'll be really loud. So what we've been doing is, since the dates I gave you here are through the March 16th through April 30th. We've provided 26 webinars, so virtual education programs, trainings, professional development, informational sessions, roundtables, those kinds of things related to the COVID-19 pandemic. We were asked to provide legislative guidance and updates and resources on the CARES Act, so we continue to do that. And I do have information at the end of the slides on how to reach out to us directly if you haven't had success in that. I can't guarantee that you will have success in that, but I do have a listing of some of the smaller lenders and folks that are doing still doing PPP loans. As of yesterday, I got some information. So if you need to reach out to me directly or to Nonprofits First, I can provide you with a couple of resources there. Pivoted from so those that are accredited pivoted from on-site to virtual accreditation reviews and on-site visits, volunteer training, testing, and all of that. So we, where we used to go out to somebody's office and look at all of their files and do accreditation on-site, we pretty quickly pivoted and created a tool so that we're able to do that virtually. And that can continue if an organization likes it that way, or when we can all go back to what will be the new normal, we can go back to, on-sites at an office. We do communications and updates on any of the revised HR postings, as does legal aid and some other organizations, those things that are required by the federal government, trying to make sure that we keep everybody updated and abreast of what that is.
Sorry about that, Jessica.
That's all right. I'm good.
Okay. There you go.
One more.
See, every time I hit it.
Doesn't like that, right? There we go. Wait.
Is it this? Is
No,
it?
one more. There you go. It's fun. Doing this whole thing is very fun, and I know everybody has a sense of humor about it by now, or maybe not. Maybe they're over it, right? So we also do, COVID-19 small business community resources updates emailed on Thursdays. So there'll be one today that goes out. We do them every Thursday. So things that are going on in the community, whether they're related to things that you share with me, James, or updates from the governor, or updates from local nonprofits that are providing some unique services that can help out the constituents and our community. All of those things we try to, track, find, and create an update that's pretty easy to understand and read. And then we update that on our website weekly. So if you haven't visited that at nonprofitsfirst.org, there's a COVID line at the very top of the page. You want to click on that. This is very important. We created and distributed a nonprofit immediate needs survey. If you haven't filled that out, it does come out in our weekly update, or you can just do it on our website. But I will tell you that I receive a lot of requests from funders, and we have matched some funders to certain organizations that have contacted us directly, that have looked at the immediate needs survey or have asked us for information. So that's why we do that. So if you haven't filled that out, you're not on anybody's radar as far as that goes. So please, 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 nonprofits, if you're listening and you haven't done that, fill out that immediate needs survey, because it really is something that folks look at, whether they're even a funder that you know of, or even somebody that's got money out there and wants to support a need. That's where they're going. And as far as I know, that's the only aggregate site in the county that is kind of collecting that data. And that's updated daily on the website. James keeps hurrying me along.
Yeah.
That's all right.
Yeah, I'll figure this out.
Let's see. We're connecting them to donors, and we can go on to this one right here. So going forward, this is as of 5/1 last Friday. We'll still continue to provide these educational opportunities as it relates to the COVID pandemic, and then outside of that. So we don't see ourselves going back to in-person type of trainings. There's that dog I was talking about. And continuing to do roundtables with financial groups, development groups, CEOs, leadership teams, so that folks have a place to sort of discuss and feel free to kind of say what in the heck's going on in my world, and gathering that information. There'll also be a financial management series that we're putting together that responds specifically to COVID and finance practices and tools for what you need to be doing today as it relates to financials, and that'll be announced. We'll send that out in our updates, and it'll be on our website as well. You can expect to see that within the next 30 days, and that'll be a series as well. We've partnered with another organization to provide that. For those of you that are listening, that also went through our financial management training program and certification back in February, when we were all together in one room. It's the same company that's going to be providing that. And they've created a whole series. It's really amazing to help everybody sort of navigate the whole rebudgeting, rethinking about financial management in the nonprofit world specifically. James alluded to this earlier. We are convening and leading a reopening work group to discuss challenges and the concerns for the local nonprofit sectors. And we've got a pretty good group already that we've put together in conjunction with the Nonprofit Chamber and Vanessa Coe from the Legal Aid Society in Palm Beach County. If that's something you're super interested in, we're kind of trying to keep it a manageable group, but if you feel really strongly about that and have thoughts on that, reach out to me directly. But we have put that group together already, and the first meeting is Monday because we feel like we need to really kind of move forward pretty quickly with this. We will not obviously be hasty in any decisions or anything that we have. We will use OSHA guidelines and legal guidelines and create resources and webinars with this work group recommendations. And if there's any changes to HR procedures or laws or whatever the case may be, we'll take a look at all of that as well. But we felt like that was a good group to put together. And at a couple of people's requests, James being one of them. This is a pretty cool thing. Because I can't show it to you yet. We're implementing something called an Inspire Service volunteer platform. The first piece of this volunteer platform, or this platform, is to actually track funding and volunteer hours that have been lost due to COVID-19. So when we launch it, we will be asking the nonprofits to complete some information. It's pretty easy to do. It will take 10, maybe 15 minutes for you to do. And again, it's going to be a great tool for the community to see how has this impacted our nonprofit organizations? How have they lost people to work with them? How have they lost funding due to events or other things that have happened to them because they aren't able to be open? A lot of our nonprofits operate thrift stores and retail shops. Those have all been closed for 6 weeks. So this will track that information in a research database that we think will be very, very helpful for funders and for the community as a whole going forward and in the future. When we look back at how did this impact our community? The other piece of it is an opportunity to connect volunteers, and we will obviously be connecting with other sites that have volunteers like United Way and such. And so that's something that we'll be implementing probably in the next 2 weeks. And that will be a neat thing. It also has kind of a heat map that shows where you have gaps in service based on folks that fill it out. So if there's some area in the county where there's not a nonprofit that's providing a certain service, it will actually show that. So it's a pretty neat tool that we'll be implementing shortly.
And I see a couple of questions. One, I believe is to you, Jessica, is asking, Jillian is asking, is if you can coordinate all this with, or if you are coordinating with United Way's volunteer efforts.
Yeah, what we'll do, it'll actually link to their website. That's what it does. But I mean, this is like something that we actually signed on and looked at like a week ago. I mean, we're trying to implement this stuff pretty quickly. And it's a nationwide initiative. So yes, I mean, it absolutely will. We're not going to be, you have to see it for me to be able to explain it. And I really just wanted to bring it up today so that folks knew it was coming. But it's not replacing anything, but it's more of a sort of a database where you can kind of see what's happening. So if it's United, we know United Way has an amazing volunteer center, and it will have a link to that.
I think that was the only question
Right.
your presentation.
And I think the other things we're still continuing to do are the immediate needs survey that'll always be up for quite some time, connecting donors to that. We've got probably another big project that I can't quite announce yet because it's not solidified. And then we'll, for those of you that don't know, that the online foundation center that used to be something you could only access via going to an office like Spirit of Giving or the library or our office is now available online for a little while. I don't know how long they'll do that, but they're doing it now. And we have the information on that on our COVID website as well. So you will have the ability right now to go out and do searches on that foundation online software, which you do not have and have not had in the past. So you might want to take advantage of that as well.
All right, let me see if I can advance. It has something to do with me dropping these slides in because it should advance normally now.
Don't worry about it. It just had information. I mean, most of us, I hope everybody knows, just nonprofitsfirst.org is our website. Yep. And then the COVID page is linked at the top. Our main phone number, if you have any questions, info@nonprofitsfirst.org, we'll get to any one of us and we will answer your questions.
Thank you. Thank you so very much, Jessica. I see you guys have been extremely busy. I know it will be helpful to be able to develop that work group and to hopefully develop a template or tools for nonprofits to be able to open safely, considering the types of jobs that they're engaging in and how they can make the workplace safe and interacting with clients. So we really look forward.
And that was taken into consideration, like with the group. So we've got somebody from mental health, somebody from general health, somebody from a children's organization, you know, and somebody from the homeless organization. So trying to encompass everybody. And then of course, Marlene from the nonprofit chamber and a few people from our staff as well, so that we want to encompass and think about what every aspect of nonprofit work looks like.
Very good, very good.
Thank you.
I see a couple of other questions related to testing. Two questions. One is, can people get tested if they don't have symptoms? And then the other is, should they get tested if they don't have symptoms? There are a number of sites that people can go to be tested if they do not have symptoms. As a matter of fact, Boynton, the Genesis site, they are testing, I believe, 2 or 3 days a week. I'll get that schedule to you. They have a rapid test that will allow you to, I think, get a fingerprint prick to see if you are positive. And if you are, then you end up following up with a swab as well. But they're rapid tests, so you'll find out right away. Found Care, when they came maybe a week and a half ago to Gaines Park, they had about 500 testing kits and only saw about 250 people. And so they didn't have to have signs or anything like that. And so as we are made aware of those locations, we will share that information with you. Within the next 24 to 48 hours, I'll post some information on the Community Services website. Information is posted on the Public Affairs or pbcgov.com website, and I'll make sure that they put an asterisk or highlight on that site where you can go to be tested if you do not have symptoms. Okay, so let me see if I can get to the next one. Looks like our slides will begin to advance normally now, and I'm going to allow Julia to just give us an update of where we are as it relates to unemployment, reemployment, and all of the work that she's doing to stabilize some of the families that are impacted by this. So Julia?
Okay, so it's all about jobs still in it, and I wanted to share some numbers with you before we continue on with the jobs that are available in Palm Beach County. Can you hear me okay?
Yes, we can hear you. Doris, can you guys hear okay?
Yes, I can
Doris,
hear.
can we hear okay? Can you hear okay?
Hear.
Okay, we're good, Julia.
Great.
Okay.
Next slide, please.
Okay.
So taking a look at this chart, this is exactly what I showed you last week. We have not had any kind of updates yet. They're going to update them once a week, so it'll be tomorrow. But as you can see, we still have, we're in 4th place in the state for unemployment behind Miami, Broward, and Orange County. And then the industries that are most affected, as you can see, are accommodation and food services, retail, healthcare, and social assistance, followed by admin. The top part of the claimant by industry chart shows none given. You can see that that's 7,700. Those are possibly people who are the gig workers and small business owners that actually don't identify themselves by industry. But either way, we know that hotel, food, and lodging are the #1 impacted in our area. And out of 1.8 million claims so far in the state of Florida, a lot of them are duplicates because people went online and tried to apply, and then they sent in a paper application. So the state is now going through all these applications, trying to figure out who's who, what's what. And then they have to validate wages and identification. So based on that, they have verified almost 500,000. They've processed 769,000, and they've paid 481,000 claimants. So it's moving at the state level. May I have the next slide?
Sure.
So if you have any questions on how to apply, you can start taking pictures of my slides if you'd like. But everybody knows, go to floridajobs.org/RA application on your phones, and you can apply right through your phone. If you are a new claimant, you have availability to apply for unemployment 24/7. If, however, you're going in to look at your application, you have a pre-existing claim, even if it's from a long time ago, you are available to go into the system Monday through Friday from 8 a.m. to 8 p.m. And if you are applying for pandemic unemployment, you still need to apply through the Connect system. So if you have applied after April 5th for the pandemic unemployment, then you are good to go. If you applied before April 4th, you should go back in and check your application. And if you can't find it or can't link to it, you can reapply as well there. Next slide.
And I apologize for the formatting. That's all on me.
It's all on you. Okay. So we still have available jobs in Palm Beach County. Believe it or not, we are still putting people into jobs. We got 113 job postings this week alone. They're available on employflorida.com, which is our website. The top industries that are hiring right now are healthcare, office and admin, and protective services. So you can see here, the first column is actually all healthcare, coding specialists, telenurses, billing, training, supervision, telehealth. And the recruiters are listed right below. So if you're interested in any of these jobs, you can contact that recruiter. And you'll see that we also posted the salaries to go with those jobs. For security, we have a lot of security positions open. I actually have 2 slides with security. These are armed and unarmed. And then we have industry and logistics and mechanics and movers. Those have 3 separate recruiters to address each one of those. Again, we have many positions for each of these jobs. And the third slide of available jobs is housing and security again. So this housing technician 1 and 2, we have 21 positions for each one of them. And housing case manager, that recruiter is Robin Parsons. She is our hospitality recruiter. These positions are also for the Gulfstream Goodwill industry, so you can contact them or us. And for those security jobs, we have numerous positions for bank protection officers for various locations around our county. There's 30 positions available. These positions are all through G4S Secure Solutions if you'd like to contact them directly. If not, you can go through our website, employflorida.com. They're all in there, and you can apply to all the jobs that are in our system. So I hope that helps you find some positions that you can possibly go into, employflorida.com, register, and then apply for these jobs.
Thank you. Thank you very much, Julia. Greatly appreciate that.
And then this is actually a slide that I threw in there. I love this slide because it tells you you're a gig worker, an independent contractor, or you're self-employed, exactly how do you apply, when do you apply, and what do you do. And then anybody who applies for unemployment now, if they are eligible for the $600 federal dollars and the state money, which is up to $275. It's for 12 weeks, but it can go up for another additional 13 weeks after that. So if you were laid off because of the pandemic, or if you were laid off because your business closed, or even if your hours were cut, you are eligible for unemployment. If you go back and get another job, you then have to claim your weeks up till the time you were unemployed. And then when you get that job, then you take on that job. If you're offered a job by your employer who furloughed you, you have to go back to work. If not, you will lose your benefit.
So I think that may have answered the question from Greg. Did you see the question in the chat box? It's basically, two things. One, yes, Greg, we'll make sure that you have a copy of the presentation. You can go to pbcgov.com/community services, and this webinar is recorded there, so you can grab it from there. And then the other question is, if someone is laid off for over a month and they got another job, they still get the extra $600 a week during that laid off period, even though they went back to work before getting the unemployment because of delays.
Good questions, very good questions, Greg. If you get another job and you've been waiting for your unemployment, for those weeks you were unemployed, you should be getting your unemployment and the $600 per week had you registered correctly in the time frame for the pandemic. If we're talking about a job back in February, no, you won't get the $600. But if you've gone back to work and you're still waiting for your benefits, yes, you claim those weeks you are unemployed, and you should get your funding based on that.
Okay. Very good. Any other questions for Julia before we move?
Thank you.
All right, thank you. All right, so now we'll just take a moment to hear from our other community partners. We'll start with Julie Krefel. So Julie, if you could give us an update on what's happening in the food world. There's always so much happening there. And then we'll look to hear from June, if you'd like to share a few things about what's happening with the school district. And John, if Ann is not still on, you want to talk a little bit about the behavioral health world. And then Randy, you can share any updates from the funders group that you may have. And I'll share any updates from the housing world if Tarun is not on. So go ahead, Julie.
Hello, everyone. There's lots happening, as James said, and I'm going to lead off with the Area Agency on Aging, and they have launched their program with 2Js. They're partnering with them to deliver meals to homebound seniors. That started last week, and they anticipate serving today, just one day alone, 9,000 meals. They're in the 5-county region. They're looking at between 35 and 40,000 meals going out this week. That's not all partnering with 2J. With 2Js. That's other partners that they have. I've sent out a weekly update to my list of partners, and anyone that would like to be added to that, please let James know or let me know, and I'll be happy to add you. The press release about the Area Agency on Aging's partnership with 2Js was sent out through that list as well. And anybody that would like to, or know a senior or is a senior that would like to receive a meal pack and they're over the age of 60, can register by contacting Area Agency on Aging helpline. And I'll give that to you guys really quickly. It's 866-684-5885. And excuse me, there's drop and go locations for registered seniors to pick up their meals, and scheduled for Tuesdays and Thursdays at varying facilities in the northern and the southern part of the county. So there's also a program happening out in the Glades with some faith-based organizations and the municipalities, partnering with 3 local restaurants in the Glades, where they're delivering hot meals to seniors that are living in senior facilities, as well as working with seniors that are shut in. In speaking with the folks they're managing that program and running it, they wanted to pass along that they're very grateful for all the resources that they have. They said that their food resources, in addition to for seniors, have been very sufficient, in fact, more than sufficient, and they're very thankful for those partnerships and those food distributions, et cetera, that are happening out there. We've been tracking very closely how the super pantries are doing, whether they need additional food, non-perishables, and produce every week. We track that, partnering with Palm Beach County, and they're helping get non-perishables out through Palm Beach County Food Bank, and their Palm Beach County Food Bank's distributions in April alone was nearly 1 million pounds of food, which is a huge increase because the need is so great. With the grab and go break spot meals and I guess program, there's more than 80 sites now. They're distributing about 50,000 to 50,000 children a day or meals a day. And there was a rumor that I want to make sure that everyone knows is not the case, that the school sites would not be operating this summer, but that is not the case. They will be open. I speak with them at least once or twice a week, and those sites, those 51 sites right now that the schools are managing for the grab and go break spot, will be in place. We're also getting information out to folks at the various locations about where they can find baby food, formula, and diapers, and that sort of thing, and have resources for that through Healthy Mothers, Healthy Babies. We have received a small grant, but nevertheless a grant that will help us serve adult meals to folks when they're coming to get the break spot meals for their kids. So that was generously funded by Whole Foods. It was a small grant of $5,000, but we'll be working with Flippity to get adult meals out. That way, that makes it efficient and also supports those families even in a greater way. We also connected Boucan, a restaurant here in Palm Beach, with St. George's, and they're providing them with 180 meals, warm meals, 2 times a week to help with their the needs in their community. They're very grateful, and we're hoping that'll be ongoing. We are also, the county added, just FYI for the break spot sites, I almost missed this new addition. The county added 2 more sites. One's at the Lantana Branch Library and one's at West Boca Branch Library. That'll be on Tuesdays. They have Monday distributions at High Ridge Family Center, Main Library, and the Main Library and Green Acres Branch Library. And then Wednesdays, they're at Belglade Branch Library, Lula V. York Branch Library, and Clarence Anthony Branch Library. So it's staggered. Again, that's in the hunger relief update, all that information. So anybody who would like that and doesn't have it, please reach out to me.
Can you just put your email or where they can in the chat button?
Yes, I definitely will. Thanks, James. And we don't have, I was hoping I'd have an update, but I would expect to have it tomorrow at another meeting. We don't have an update yet on how the PEBT is going with folks being able to get through the DCF and FDACS, they're partnering so that they get the dollars or the money from the free lunch or the free and reduced program on their EBT cards. I'm assuming that's going smoothly. We haven't heard anything differently, but please let me know if anybody hears anything. And then lastly, we'll be getting an update. Hopefully I'll have it for you for next week on the online grocery purchase pilot program through Amazon and Walmart. And again, I was hoping I'd have that for you guys today, but I don't. And I think, James, that is all for me today.
All right. Thank you. Thank you so very much.
Thank you.
John Hewlick, do you want to give a quick update on what's happening in the behavioral health world? Can you hear me, John?
James, can you hear me?
Yes, we can.
Great. I appreciate and thank you for hosting these forums. They're incredibly helpful. I know clearly to me, but to other community partners. So, as and Ann couldn't be here, but I have been participating, as have many providers, on thrice weekly calls of the provider community since the beginning of the pandemic. So, good news is that from a service level capacity, we've been largely able to maintain the level capacity, which is very good news. Obviously getting PPEs to the provider community, addressing those needs, a transition to telehealth very successfully. So from a maintenance of the service provision, I'd have to say that we've been very successful in doing that. Moving ahead, of course, we're looking at continuing that good work. So, thank you.
Thank you very much, John. Randy, do you have any updates that you want to give for Funders Group? And then we'll hear from June if she's available still.
Nothing new for me, James. We're still processing through the over 400 applications. There are funding decisions being made. I think one reason it's maybe going a little slow at this point is kind of trying to gauge how long is there going to continue to be needs for what is reopening going to look like, and how will that affect the different populations that might need some assistance? And then also for families with children, what is the summer going to look like, assuming a major impact on summer camps? And of course, once May ends, kids won't be occupied with school any longer from home. So what are they going to be doing?
Randy, have there been any announcements about summer camp? I'm just been out of the loop a little bit in that regard.
No, and certainly Tammy or Gita from over in Youth Services would probably be one of the best. I know they were doing a survey and trying to gauge, I think, which camps are even, trying to be open. And of course, based on how the reopening rules will work, it may not be much of a choice anybody really has.
Okay, I will certainly maybe invite them on next week to give an update on where they are. I think the initial with the governor's executive order, you're right, does exclude them. I don't think that it actually shut. Well, let me just confirm before I even say that. But we'll give you an update on what's happening with the summer camps, perhaps next Thursday, because I know that is extremely important, especially for parents who have kids and they're going to be looking for things to do. June, do you want to share any highlights from the school district, things that you're working on, challenges that we might be able to assist you?
Well, thank you very much for the opportunity. And in follow up to what Randy was just referencing, I just want to let all the participants know that last night, Dr. Fenoy did an interview with WPTV that I can send the link over. It was about 30 minutes long, but in there he talked about some of the concerns that we're hearing, partially about whether we're going to run our camps or not, whether there'll be summer school, et cetera. So a lot of that was covered in that, one-on-one with Dr. Fenoy yesterday. So I, rather than me rehash all of that, I can send the link and we can link it if you want. But, the other piece of that is the feeding sites. We continue to get questions about, having families that are saying that, we're not able to access food or what have you. I would really encourage that we highlight that the feeding sites are still going, that the school centers have them. I know the person on before was mentioning that the feeding sites are going off in the community, both entities. So that's a major piece. I do want to say that we continue to struggle with connectivity for some of our families who are not able to access the Comcast opportunities that have been afforded. We have been able to, and thank you, James, for connections and all those pieces that go with this, connections with the library system, where we're going to be able to borrow Wi-Fi mobile hotspots for some of our families that are experiencing homelessness, which we're hoping to pick up next week, get out to them, and that at least it gives them the opportunity, to be able to access our classrooms and our live, lessons that we're doing with these students. For some of these families, it's late in the game, but we're hopeful that we'll be able to continue that connectivity through the summer and whatever the virtual learning environment looks like later. Those really are the pieces that I just wanted to, bring forward. Again, Dr. Fenoy covered a lot of it on the WPTV interview yesterday, that are the concerns that was based off of questions that were sent in by, viewers. So.
Okay, thank you very much. Well,
questions for me, I can answer if they're in the chat box.
Okay. So, and I want to give a quick update. We're looking, well, some of you may have seen on the news where the Homeless Coalition is working with Goodwill to house homeless seniors and veterans. So they're beginning to move those individuals out of the park and into hotels and wrapping services around them. And so that began today. And in the past week and a half, the the census in the park has dropped from, I think, 172 to 152. So we are starting to trend in the right direction in terms of the encampment. We are also looking as a department and as a continuum of care for housing and homelessness to position ourselves for an increased demand in housing services, rental assistance, eviction prevention services, things of that nature. And so the board did approve some of the funding that's come down from the state and the federal government. Some of the criteria for that funding has been expanded. I won't get into details about the criteria, but we will post it on the website and try to make it as succinct and as easy to understand as possible so that clients or individuals who are falling on hard times and they need to access services, they'll have that safety net to fall on. And so for some of the normal funding that we would receive, we'll use our existing infrastructure to try to push that out and to provide those services to the individuals in need. And then for some of the CARES funding that will come down, some of which I shared with you in previous slides. We're planning and looking at how we would need to increase capacity in order to meet the demand for those individuals who normally wouldn't be in a situation like this, fall above the 150, 200% poverty rate, and they're really in need of services. So we'll be sharing more information about housing and rental assistance and eviction prevention services in the coming weeks. The governor's executive order ends in 1 week. The court's executive order will end at the end of this month. And then if neither of those are extended, they will be allowed to evict. And so that process begins again. And so we just want to, part of the reason we're coming together here every week is to share information about what's available and to prepare ourselves for you as individual organization to start positioning yourself to be able to manage some of the increased demand in services that we're expecting as a result of this coronavirus. And so we appreciate all of the work that you continue to do. And we hope that you'll continue to share this useful information with us and work with us as your community partners to provide the safety net for our residents in need. So any other panelists have things that they want to share before we dismiss this call? All right, seeing that there are no additional comments, we'll end this webinar again. You can go to pbcgov.com/community services, probably by tomorrow, late tomorrow afternoon, and see a recording of this. So if you're interested in getting the slides and all of this information, you can see this webinar and others on that site. So with that said, we're signing off. Be safe, stay home still, and we'll see you next week.